Okay, so now I'm going to start with, let's see, Alicia, can you go ahead and start reading on page 2 for the introduction to medical record? If you'll read the first 2 paragraphs for chapter 1.
Okay. Medical records are a crucial part of a medical practice. A medical record is a written record of the important information regarding a patient, including the care of that individual and the progress of his or her condition. The patient's medical record serves many important functions. The provider uses the information in the medical record as a basis for decisions regarding the patient's care and treatment. The medical record documents the results of treatment and the patient's progress. The medical record provides an efficient and effective method by which information can be communicated to authorized personnel in the medical office.
Awesome, thank you.
Mhm.
Okay, so I want you guys to go ahead and highlight on the first paragraph where it says a medical record is a written record of the important information regarding a patient, including the care of that individual and the progress of his or her condition. And then I want you to highlight on the next paragraph, the second sentence, where it says the provider uses the information in the medical record as a basis for decisions regarding the patient's care and treatment. All right. Let's see. Anastasia, will you go ahead and read the next 2 paragraphs, please?
Can you repeat the second part that we have to highlight?
Yes. So on the second paragraph, it'll be the second sentence that you'll need to highlight.
Okay, the medical records also serves as a legal document. The law requires that a record be maintained to document the care and treatment being received by a patient. If something goes wrong, good documentation works to protect the provider and the medical staff legally. Incomplete records could be used as evidence in court to show that a patient did not receive the quality of care that meets general accepted standards. The medical assistant should always keep in mind that the information contained in a patient's medical record is strictly confidential and must not be read by or discussed with anyone except the provider or the medical staff involved with the care of the patient. See, see the box highlighted on the HIPAA privacy rules.
Awesome. Thank you. Okay, so the only part left that I need you to highlight is going to be in the third paragraph, the very first sentence, where it says the medical record also serves as a legal document. And we'll go over further in far as the HIPAA. Does anybody have any questions on anything so far? Okay, good. All right, so now we kind of know what a medical record is. Now we're going to start breaking down into the specific parts of what is considered part of a medical record. Nancy, did you get the right book?
Yeah.
Is that a yes? I'm sorry.
Yes, ma'am.
Okay, all right, good. I'm sorry, I just now see your question. Okay, so let's see. Alexis, will you go ahead and read the paragraph under the components of a medical record and the medical office administrative documents?
Yes, I'm trying to get my book together.
That's okay. That's all right. You go right on ahead.
What page are we on? And
We are on page 2. And then you'll read the components of the medical record and the medical office administrative documents.
that's page 2.
Mm-hmm. All right, looks like we might have lost Alexis. Okay, so let's see. Danae, can you go ahead and read those two paragraphs, please?
Okay. You said the components of the medical record and the medical office administration or
Yes, ma'am.
administrative documents? Okay.
Yes, ma'am.
A medical record consists of numerous documents. Each document in the medical record has a specific function or purpose. Medical record documents can be classified into categories. Each of these categories is listed and described below, along with the specific documents or reports included in each. And then administrative documents contain information necessary for the efficient record keeping management of the medical office and include the following: patient registration record, notice of privacy practices, acknowledgement form, and correspondence.
Awesome. Thank you. All right. Let's see. Jasmine R., if you will, go ahead and read the medical office clinical documents and laboratory reports.
Medical office clinical documents include a variety of records and reports that assist the provider in the care and treatment of the patient and include the following: health history report, physical examination report, progress notes, medication record, consultation report, home health care report. A laboratory report is a report of the analysis or examination of body specimens. Its purpose is to relay the results of laboratory tests to the provider to assist in diagnosing and treating disease. Laboratory reports include the following: hematology report, clinical chemistry report, immunology report, urinalysis report, microbiology report, parasitology report, cytology report, histology report.
Awesome. Thank you. Okay, so for the medical office clinical documents, you're only going to highlight the first 4 bullet points: the health history report, physical examination report, progress notes, and medication record. For laboratory reports, I just want you to highlight the following. A laboratory report is a report of the analysis or examination of body specimens. Its purpose is to relay the results of the laboratory test to the provider to assist in diagnosing and treating disease. All right, let's see. Alexis, let's try this again. If you will read the diagnostic procedure reports and therapeutic service reports.
Okay. A diagnostic procedure is type of procedure to assist in the diagnosis, management, treatment of patient's condition. Diagnostic procedures consistent of a narrative description and an interpretation
Mhm.
of a diagnostic procedure and include the following: electrocardiogram,
Mm-hmm.
Holter monitor report, colonoscopy report, spirometry,
Spiometry.
radiology report, and diagnostics imaging report. Therapeutic services reports document the assignment and treatments designed to restore a patient's ability to function and include the following: physical therapy report, occupational therapy report, speech therapy.
Awesome, thank you. Okay, so I want you to highlight all of the diagnostic procedure reports and that very first sentence under therapeutic service reports. Lily, will you go ahead and read hospital documents and consent documents?
Hospital documents assist the patient's provider in reviewing the patient's hospital visit and in providing follow-up care. Hospital documents are prepared by the provider responsible for the care of a patient while at the hospital and include the following: history and physical report, operative report, discharge summary report, pathology report, and emergency department report. Consent forms are legal documents required to perform certain procedures or to release information contained in the patient's medical record and include the following: consent to treatment form, release of medical information form.
Awesome, thank you. Okay, so you guys are just going to highlight the hospital documents. So each of those bullet points, and then the 2 bullet points under the consent documents. So now we see it kind of tells us what a purpose of a medical record and then what you can find inside of medical records. So it breaks it down into even further. So you have your administrative documents, you have your office clinical documents, your laboratory reports, your diagnostic procedure reports, your therapeutic service reports, hospital documents, and consent documents. So once you start, once you're in the field, you're going to be able to receive information. So let's say your patient gets lab work done. Well, where do you think you're going to find those results inside that patient's medical record? Does anybody have an idea?
One more time.
Laboratory reports.
Right, exactly. So if a patient's getting any lab work done, now you know, okay, I'm going to go look under their laboratory reports to have it done. Now, if they had a x-ray done, where would we find that in the patient's medical record?
Diagnostic procedure reports.
That's right. So you kind of already have to start with that knowledge of, okay, now I know what is inside of a medical record, and then you're going to have to continue to go further. You're going to be able to have to know, okay, where, with what I'm looking for, where would it be inside that medical record? Very good. Okay, any questions about that so far? Okay, so there are types of medical records. There are 2 types of medical records. These include the paper-based patient record and the electronic medical record, which are described in more details as follows. All right, so a paper-based patient record. Medical offices may rely on the use of paper medical records, known as paper-based patient records, or PPRs. Although most of the medical record is paper-based, some patient data are maintained on the computer. These include patient registration information and patient charges and payments. Many of the documents include a paper-based record consent of pre-printed forms that contain specific information documented by the patient, the medical assistant, or the provider. Examples of these forms include the patient registration form, a health history form, and a medication record form. Then we have our electronic medical record, our EMR. It's a computerized record of the important health information regarding a patient, including the care of that individual and the progress of the patient's condition. As technology has advanced, most offices have converted, either partially or fully, to an EMR for maintaining patient health information. With an electronic medical record, the entire record is stored in a database on the computer, including the health history report, physical examination report, medication record, progress notes, laboratory and diagnostic reports, hospital reports, and consent documents. EMR software allows for the creation, storage, organization, editing, and retrieval of medical records on a computer. The EMR is usually linked to or incorporated practice management software for scheduling, billing, and filing insurance claims. This allows the EMR to include more information than a traditional medical record. Okay, so I want you guys to highlight where it says paper-based patient records. Highlight electronic medical record. And then also highlight where it says an EMR software allows for the creation, storage, organization, editing, and retrieval of medical records on a computer. Many of the documents in an EMR consist of forms known as templates that are displayed on the computer screen and are filled out in much the same way as a paper form. Each computer template includes spaces known as fields, in which information is entered by healthcare personnel. Figure 1.1 illustrates an example of the medication record computer template, which fields for entering information relative to a patient's medications. Okay, so let's see here. Nancy, will you go ahead and read the advantages of the electronic medical record?
Okay. The incorporation of an EMR in the medical field office typically leads to better quality patient care through improved communication, faster access to data, and clearer and better documentation. These advantages are accomplished as described in the following 3 sections.
All right.
Do you want me to keep reading?
Go ahead and keep reading on the rest on page 3 for me.
One of the principal advantages of an EMR is that the computer can retrieve requested documents from a patient's record very quickly. This avoids having to perform the much more time-consuming task of manually hunting through the paper-based record to locate this information. In addition, documents received from outside facilities, such as laboratory reports, can be stored very quickly in the EMR. EMRs do not need to be filled as with a paper-based record. This saves considerable time and fees up in the office space required to store paper records. Paper costs are also reduced, and time is saved in not having to look for lost records.
Awesome, thank you. Okay, so I just need you guys to highlight where it says you can retrieve requested documents from a patient's record very quickly. And then highlight where it says EMRs do not need to be filled. So if you guys look at your clinic folder and what is inside of your clinic folder is filed, that's basically pretty much how a paper-based patient record is done. So if you can imagine, whether it's the patient's insurance, lab results, consent forms, diagnostic reports, your doctor's progress notes, everything will be filed in that. So if you can just imagine how thick paper charts can be. And it is very difficult unless you have a great filing system inside that chart. It's not easy to find everything that you need. But with an EMR, it's organized. So every office, some offices use the same EMR system. Like Baylor uses Epic. But if my primary care doctor works for Baylor and the hospital for Baylor, they may only use certain templates out of that same EMR. Does that make sense? All right, so the EMR, the templates are basically built per what the office needs. So they can adjust and change however they need to. It makes it easier when it comes to the EMRs. I wish I could go ahead and show you guys an EMR system and allow you to become familiar, but unfortunately, because there are so many, it is very difficult. But if once you go on your externship site, if they do use an EMR, they will train you on how to use that. So that won't be a problem at all. All right, any questions about anything so far? Okay. So now let's go ahead and turn to page 4. And Natalie, if you will read what is the HIPAA privacy rule, please.
The acronym HIPAA stands for the Health Insurance Portability and Accountability Act. HIPAA is a federal law consisting of several components, one of which contains provisions to protect a patient's privacy, known as the HIPAA Privacy Rule. The HIPAA Privacy Rule went into effect on April 14, 2003. The primary purpose of this rule is to provide patients with better control over the use and disclosure over their health information. All healthcare providers, health plans, and healthcare clearinghouses, billing services that use, store, maintain, or transmit health information must comply with this rule.
All right, awesome. Thank you. So you will hear the HIPAA privacy rule a lot. So you do need to make sure that you do understand what it is and the meaning of it. So I want you to go and highlight on that second paragraph where it says the HIPAA privacy rule went into effect on April 14th, 2003. And the primary purpose of this rule is to provide patients with better control over the use and disclosure of their health information. Thank you, Natalie. Sabrina, will you go ahead and read what is included in the HIPAA privacy rule and number 1, please?
The HIPAA privacy rule is outlined here as it relates to the medical office. The medical office must develop a written document known as a Notice of Privacy Practices, NPP. The NPP must explain to patients how their protected health information, PHI, will be used and protected by the medical office. Protected health information includes health information in any form, written, electronic, or oral, that contains patient and identifiable information, name, social security number, telephone number. The medical office must make a reasonable effort to provide an NPP to each patient and to obtain a signed acknowledgement from the patient that he or she has received an NPP.
Awesome, thank you. So you guys are actually going to want to highlight the entire number 1. So have you guys gone to the doctor and they provide you with the notice of the privacy practices? They ask you to sign that you received it, and then they ask if you would like a copy of this. Have any of you guys ever had to do that?
Yes.
Okay, so that's what this is. So normally you would have to, as a patient, a lot of times you'll have to do this, if not every single time you go into the office, or at least once every 6 months. And some offices will do once a year. They'll make sure that everybody, has signed and updated these documents. So good. Okay, so let's see. Talia, will you go ahead and read number 2, please?
A patient written consent is not required for the use of disclosure of PHI for the following: medical treatment examples. 1, patient referral to a specialist. 2, emergencies are provided at a hospital. 3, tests on a patient performed by the laboratory. Payment examples: 1, determination of eligibility for insurance benefits. 2, review of service provided for medical necessity. 3, utilization review activities. Healthcare operations examples: 1, quality assessment activities. 2, contacting patients with information about care or treatment. 3, employee review activities. 4, training of healthcare students.
Awesome,
Do you want me
thank
to go
you.
on? No.
No, that's okay, thank you. All right, so on number 3, patients have the right to access their medical records and to request changes to the records if they believe them to be inaccurate. So for number 2 part, I want you to highlight a patient's written consent is not required for the use or disclosure of PHI for the following. And then you're going to want to highlight number 1 and number 2 under medical treatment. Number 1 under payment, and number 4 under healthcare operations. All right, and then Alexis, will you go ahead and read number 4 for us?
To prevent unnecessary or inappropriate access to PHI, the medical office must make an effort to limit the use of disclosure of and requests for PHI to the minimum necessary to accomplish the intended purpose. A request from insurance company for procedures performed on a patient. This requirement does not apply, however, the use of PHI for the routine practice in the medical office.
Awesome, thank you. All right, Alicia, will you go ahead and do number 5?
Patients have a right to request an accounting of the transfer of their information for purposes other than treatment, payment, or healthcare operations.
Thank you. And Anastasia, will you go ahead and read number 6?
Businesses associated to whom the medical office may disclose PHI must respect the HIPAA privacy rule. The medical office must execute a written agreement with each business associated to held a PHI in accordance with HIPAA. A business associate may include the following organizations and firms: medical laboratories, transcript services, law firms, accounting firms, software and hardware and billing services.
Awesome, thank you. All right, Danae, can you go ahead and read number 7 and 8 for me?
The medical office must implement for all employees a basic training program on privacy and security of PHI. The medical office is required to put in place appropriate administrative, physical, and technical security safeguards to protect the privacy of PHI from accidental use or disclosure or violation of the above listed requirements.
Awesome, thank you. So what if a medical office does not comply with the HIPAA privacy rule? There are several penalties if a medical office fails to comply with the HIPAA privacy rule, which can include civil and criminal penalties. Where can more information on the HIPAA privacy rule be found? The following website contains current information on HIPAA, www.hhs.gov/HIPAA. So once you start, and even in probably in your externship, even as a medical assistant, you will go through these little trainings where you have to watch, what is HIPAA, what is OSHA, how to use your PPE properly. So you're going to constantly be always training on these items. Okay, so now we're gonna go ahead and look at case study number 1. So Moriah Celeste, an account executive for a large insurance company, comes to the office complaining of insomnia and depression. 3 months ago, her husband of 27 years left, and now they are legally separated. Since then, Mora has had a lot of trouble sleeping at night. She also feels lethargic during the day and hasn't been eating much. Mora says that she's been having some problems with alcohol. She wants to know any community agencies that could help with her problem, but that would be sure to keep the information confidential. She has a very responsible job, and her firm does not want anyone to know about her alcohol problem. She also does not want any information about her problem put in her medical record, and she especially does not want the physician to know about it because he is friends with many of her colleagues at work. Okay, so there's 2 things. There's a what would you do and what would you not do. So as a class, let's start with what would you do? Any ideas on how to handle?
Could we recommend her something?
You could, yes. So you can recommend her to facilities that help with deal with abuse, like alcohol, drugs, things like that. So what's something else that we could do?
Advisor to see a counselor. Talk about it.
Okay. All right. What else could we do?
She could go through her like insurance, couldn't she, or like her job to see what they have to offer?
She could. She could. Anybody else?
So when she was with her husband at first, she probably signed a paper saying that they could legally tell him things, so she should probably update that as well, right?
That's right. So that's a good point. So in this case study, we realized, okay, she's recently become legally separated, which means legally we have a right to our patient. So that this is where when listening to your patients comes highly important. So what should we do for her? So she's legally separated and she's concerned about her problems and not letting her problems become a public matter, right? So, what are some things that we could do to help our patient?
She could sign an MPP.
Okay. Well, what about her doctor? So, her doctor, she said that her doctor's friends with her legally separated husband.
Well, that's illegal.
That's right. So, that doctor that she's referring to, well, that's our doctor that we work for. So, we would not want to, you know, we would need to, you know, ease some of her worry that legally he cannot,
Yeah.
right? All right. So that's some good points on what would you do. So now what would we not do?
Can't tell her, like, we can't imply anything that we're judging her or make her feel like she's wrong for it.
That's right. Yeah. So she's coming to us for help. She's coming to see the provider for help. So the last thing that we want to do is criticize our patient. So that's good. We don't want to say, "Oh, well, you need to stop drinking." Okay, well, we obviously she needs help. So we don't want to criticize her for, some of the problems that she's having. So good, good. So what's another thing that we would not want to do?
Not discuss her information with her ex-husband, I'm guessing he is.
That's right. That's right. So we need to make sure that we have her sign the appropriate documents. We need to make sure as a medical assistant that we abide by our patient's privacy, which means that if her legally separated husband comes into the office, we do not give him any information. We respect the patient and respect the legal documents that she signed. Very good. Okay. Any questions about anything so far? Okay. So now let's go to page 5. So before, it kind of said to see figure 1.1. Well, now this is 1.1. This is an example of a medication record computer template. So let's take a look at it. So we see that under the office visit part, it looks like for this particular patient, so here it's given us lots of little drop downs. So there's one for medication, one for strength, form, route, frequency, dose, start date, indication, and status. So when, as a medical assistant, when you are talking to your patient, the one question when we're gathering information from our patient is we ask them, what medications do you take? Well, there's a golden rule, okay? And everyone needs to write this down. If it was not documented, it was not done, which means if we ask the patient what medications they're taking and we did not either write it down or put it into the system, then guess what that means for the patient? They don't take any medications, right? Well, that's not the case. So we need to make sure that anything that we do for our patient, any information that the patient gives us, we document it. Okay? So it's going to be very specific when you're documenting information inside of an EMR, but you also want to make sure that you, if you're doing a paper chart, you document the same information. So medication. So we need to know the name of the medication the patient's taking, the strength. So this is how many milligrams, for example, are they taking? What kind of medication? Is it a liquid? Is it a tablet? Is it a capsule? And how are they taking it? For this patient, it's orally. Frequency. That means how many times does the doctor prescribe this medication? Do they take it once a day, twice a day, 3 times a day? And the dose. So that's the 1 tablet. They're taking it daily, and it's 1 tablet daily. Start date. Sometimes the patient will be able to tell you the start date. Sometimes they can't, but you need to make sure that you ask them. The indication. So why are they taking this medication? And then the status. Are they still currently taking this medication, or has the doctor discontinued that? Okay. All right. So now let's go on over to page 6. And let's see here. Talia, can you go ahead and read on page 6 under efficiency?
Efficiency. EMR software facilitates the entrance of data into the patient's medical record. To assist the entering data, EMR programs use point-and-click terminology such as radio buttons, drop-down menus, and free text entry. And notes, radio buttons consist of series of on-screen buttons that allows only one section to be made from a list of options. EMR programs also have the capability to print, customize patient education instructions and handouts. For example, if a patient has been diagnosed with strep throat, patient's education on strep throat can be printed and given to the patient. One of the principal advantages of MR is the availability to generate prescriptions as described in detail in Chapter 11.
Yes. Awesome. Thank you. Okay, so for efficiency, I just need you guys to highlight where it says to assist in entering data, EMR programs use point and click technology such as radio buttons, drop down menus, and free text entry. So when I first became a medical assistant 20 years ago, Sabrina, that's perfectly fine. I will be posting this to the YouTube channel later today, so you can always go on and catch up from there. And if you have any questions, just let me know, okay? So 20 years ago, we didn't have EMRs. Hospitals didn't have EMRs. So you had to write everything down. Well, as you know, you further along in your career, everybody starts becoming electronic. Now, once you get used to doing something for so long, is it easy to change over? What do y'all think?
No, because you're used to the way you were taught.
Exactly. So it went from knowing how to document as a medical assistant and how to search and find and place and file from a paper chart. Now you have to know how to do it electronically. But over the years, it's becoming a blessing, right? Just like our internet is. You have to get used to it, but it serves so many great purposes. So all of the EMRs, most of them, okay, and I've worked with a lot of different ones, most of them are very user friendly. You just have to know the basics, and so your job will train you on those basics. Once you get that part down, then the rest of it becomes pretty simple, but it's just like working your radio. Every button has a purpose, and it will take you to a different station if you need to. Yeah, that's fine, Lily. Those of you who have to go to Boost, if you have to log off, that's perfectly fine. I'll be posting this to the YouTube channel later this evening, so you guys can always go back and catch up and take notes from there. All right. So, any questions about anything so far? All right, so for accessibility, the EMR provides access to the patient's medical record by a healthcare professional. A patient's EMR can be accessed from any EMR accessible hardware device such as a desktop computer, laptop computer, tablet, or smartphone. This allows more than one healthcare professional to view the medical record at the same time. The EMR is also readily accessible if a patient telephones the office. This avoids having to find the patient's record and call the patient back. In addition, the provider has ready access to a patient's EMR from a remote location, such as a hospital, an extended care facility, or the provider's home. So when you start working in the field, so you can be working on different types of devices. So you may have your desktop at your nurse's desk. And a lot of offices now are using tablets for when you're actually with the patient. And some offices have desktops in the patient's room. So it all basically is just easy access to get the information that you need. But providers are also have the same ability. So if you're working for an OBGYN and they're in the hospital doing a delivery, they're going to be able to access that patient that you're inquiring about from wherever they are. And a lot of times the providers have access in their homes, just so that way they can make sure that they're staying on top of their patient stuff too. So for the accessibility, you just need to highlight where it says this allows more than one healthcare professional to view a medical record at the same time. All right, so let's see here. Natalie, can you go ahead and read the occupational tasks, please?
Certain tasks must be performed before an EMR program becomes operational. To be effective, older records should be incorporated into a patient's EMR. This can be accomplished by manually scanning the records into a digital format using a scanner. An application program known as an optical character recognition OCR program can also assist in the process. Once the record has been scanned into the computer, the OCR program converts typed text into text that can be manipulated by the computer. An OCR program can also convert a handwritten document into text, but it has a difficult time converting illegible handwriting into text.
Yes, so for a lot of our doctors, their handwriting is not legible, and that can be kind of tricky. So one thing that you guys actually may be doing once you start your externship is you may be assisting your office in scanning documents. And the purpose for the scanning documents is exactly what we just went over. So some of the doctors, they still have these paper charts. I mean, they have tons of them, and they still need to convert them electronically. So something that you may be doing is you may be scanning these documents and placing it into that file for the EMR. And it's not fun, but it's pretty easy. Okay, so now taking a health history. Okay, so before we jump on that, I want you guys to look into your binder. Under your chapter 1, you're going to see a form that says authorization for release of medical record information. So For those, so a lot of times this is something that our front office ladies will do. And as a medical assistant, that may be me too, especially if you can be cross-trained from front and back. So an authorization of release of medical information, this allows us to either ask for things or send things. This is something that a patient has to sign and it has to be filled out, and we have to make sure that we keep this on file. So let's kind of take a look at it. Okay, so the very first part of this is we have to have the patient's information. The next part is above listed patient authorizes the following healthcare facility to make record disclosure. So we have to have all of the asking information. We have to have the facility name, the facility phone, address, fax, city, state, and zip. So if your patient just moved from Washington to Texas and we need to get records from that provider, this is where they would put that information, because we have to, we can't just call the office and say, hey, we have patient so and so, they're now under our care, can you send us their records? Legally, they can't. They don't have anything asking the patient's permission to do so. We need to make sure it's okay with the patient for us to send their personal records to someone else. So then it goes into further. So it says the dates and type of information to disclose and the purpose of disclosure. So let me ask, okay, so if a patient comes into your office and they just had a x-ray done at Envision Imaging, and we do not have those results, what would we need to have the patient fill out, why, and where?
Should it be a patient or a personal, what is it called? But they sign it, get your own document, like your own stuff.
Right. So that would be, so they could sign this type of form, right?
Yes, ma'am.
Okay. So where would we, what would we request on this form, and where could I find that? Anybody?
I'm sorry, what was the question?
So where could we request this information? Where would I find that on this form?
In the middle?
Where it says dates and type of information to disclose?
Yes, yes. So we could do where it says specific information requested, and we could put x-ray results. And we could even go further. We could go ahead and offer when did the patient say they had the testing done, and we could put that date. And then, okay, so what would we consider that purpose? So on the other side of that, it says the purpose of disclosure is. Well, in this case, what would we think the purpose is?
Continuation of care.
Continuation.
Yes, that's right. So we're wanting to get these results to review so we could follow up with the patient and see if there's anything further that we need to do for the patient, or maybe there's something further we need to have the patient do, another testing. Very good. Okay, so then the next part is restrictions. It says only medical records originate through this healthcare facility will be copied unless otherwise requested. This authorization is valid only for the release of medical information dated prior to and including the date on this authorization unless other dates are specified. I understand the information in my health record may include information related to sexually transmitted disease, acquired immunodeficiency syndrome, AIDS, or human immunodeficiency virus, HIV. It may also include information about behavior or mental health services and treatment for alcohol and drug abuse. Okay, so that basically is telling us that, again, a patient's privacy is everything, right? So even though that we're requesting things that maintain very personal matter, it is still privacy. So that's not only letting our facility know, the patient know, but the facility that we're requesting things from. All right, the next part is this information may be disclosed and used by the following individual or organization. So what would we think would go here? Does anybody have any ideas?
The office.
That's right, the office. So this is where we would put our information, the office that we're working for. And then it's, again, it's very detailed. You can say fax, phone, please mail records, or please fax them. And then at the very bottom, or I'm sorry, right underneath that, in bold, it says, unless otherwise revoked, this authorization will expire on or the following date, event, or condition blank. If I fail to specify an expiration date, event, or condition, this authorization will expire 1 year from the date signed. So, some offices will fill this out. Some offices won't. And even if they don't, this is telling us that this sheet will expire in 1 year from the date that the patient signed it. All right, and then the very last part is going to be what? It's going to be where the patient's going to sign and date and do address and telephone number and all that good stuff. All right, so any questions over that form?
No.
Okay. All right, so that's going to be it for the binder. Y'all can put that one away for now. So now on page 6, now we're going to start breaking down taking a health history. So this is an important factor as a medical assistant that you probably will be doing, okay? So it is our job to gather the patient's information, call our patient and bring them back to the room, and we need to get their health history, okay? So that's what we're going to start breaking into now. So let's see here. Danae, will you please read taking a health history, if you will read that first paragraph, please. Can you hear me, Danae?
Okay, sorry, I had to move to another room.
That's okay.
Okay, so the first paragraph,
Yes, ma'am.
okay, the health history report is a collection of subjective data about the patient. Most of this information is obtained by having the patient complete a pre-printed form that is then reviewed for completeness by the medical assistant. Some of the information included in the health history is obtained by the provider or medical assistant by interviewing the patient. A quiet, comfortable room that allows for privacy encourages the patient to communicate honestly and openly, showing genuine interest in and concern for the patient reduces apprehension and facilitates the collection of data.
Awesome, thank you. Okay, so let's, because I don't think I had you guys highlight under the occupational task. If you'll highlight where it says older records should be incorporated into the patient's EMR, this can be accomplished by manually scanning the records into digital format using the scanner, and then continue to highlight that an application program known as an optical character recognition, OCR program, can also assist in the process. And then for the health history, you'll highlight the first sentence where it says the health history report is a collection of subjective data about the patient. And the last two sentences. A quiet, comfortable room that allows for privacy encourages the patient to communicate honestly and openly. Showing genuine interest in and concern for the patient reduces apprehension and facilitates the collection of data.
What was the first sentence in that we needed to highlight?
Under the health history or the occupational task?
The health history.
The health history report is a collection of subjective data about the patient, and then you'll highlight the very last two sentences on that paragraph.
Okay.
And let's see, Jasmine C., do you want to go ahead and read that next paragraph for me?
Yeah. A thorough history is taken for each new patient, and subsequent office visits provide information regarding changes in the patient's illnesses or treatment, along with the physical examination and laboratory and diagnostic tests. The health history is used for the following reasons: to determine the patient's general state of health, to arrive at a diagnosis, and to prescribe treatment, and to document any change in a patient's illness after treatment has been instituted. The term diagnosis refers to the scientific method of determining and identifying a patient's condition.
Awesome. All right, very good. Let's see here. Anastasia, will you go ahead and read that last paragraph for me?
Yes, you would call my name when I sneak away to go get food. Um, in an office with an EMR, the patient can complete a health history paper in pencil form, and the medical assistant then enters these data and or scans the health history form into the patient's medical record. An alternative is for the medical assistant to enter the information directly into the computer while asking the patient questions related to his or her health status, although not yet is with widespread uses. Computer guided questionnaires are available for a patient to complete the health history at a kiosk in the medical office or online through a secure medical office website. If the patient completes this questionnaire at the medical office, a quiet and private area for the patient to complete it must be provided, and the medical assistant must be available to answer questions.
Awesome, thank you. Okay, so on this paragraph, you guys are going to want to highlight where it says in the office, and you're going to continue to highlight all the way down to where it says a secure medical office website. Okay, so a couple things may happen once you call your patient. If, let's say, it's a new patient, the patient may actually be filling out their health history on a piece of paper. Okay, the health history will include maybe why they're there, what symptoms they're having, what medications are they on, family history, personal history, surgery history, allergies, and things like that. There are some questionnaires that we hand our patients, and a lot of times you will see these if the patient is coming in for depression, abuse, kind of along those lines. Now, if a patient is filling out their health history on paper, when you call your patient back, you're going to take that paper and you're going to put it into your EMR, okay? And at that time, you're going to probably maybe go ahead and ask them questions. You want to confirm the information that they've written down. The other part is that you bring your patient back and you're actually typing the questions onto the EMR as you're asking them. So, Miss So-and-so, what brings you in to see Dr. John today? And you're going to type that in. Okay, well, let's kind of find out about the symptoms. Okay, well, what symptoms have you been having? Oh, well, my back's been hurting. Okay, where? So you're going to just start typing away actually onto the system as you're asking your patient these questions. All right, very good. Any questions about that so far? Nope. Okay. All right, so the components of a health history. The health history is taken before the physical examination is performed, providing the provider the opportunity to compare findings. The health history consists of 7 parts or sections. I want you guys to highlight that very first sentence, please. Okay, so now we're going to start breaking down into the components of a health history. Okay. All right, so let's see here. Identification data. The identification data section is included at the beginning of the health history form to obtain basic demographic data on the patient. The patient is usually responsible for completing the identification data section. All right, so here we've got a case study 2. Brett Oberlin is 21 years old and lives at home. He commutes to a local college and is in junior majoring in art education. His mother and father have come to the medical office and asked to see his medical record. The physician is attending a medical conference and will not return, for another 4 days. Mr. and Mrs. Oberlin found some medications in Brett's room and looked them up on the internet. They found out that they are used for to treat HIV infection. Brett would not talk to them about the medications and told them he is an adult and it is none of their business. Mr. and Mrs. Oberlin are very concerned about Brett. They are also worried about other members of the family being exposed to HIV. They say that because they are supporting him, they should be allowed to see his record. Okay, so let's start with the first part. What would you do?
Explain to the parents that although they're supporting him, he's over 18 years old, which, isn't legal, so they can't legally tell him anything regardless of where he lives or who supports him or anything. So they can't say anything.
That's right. So what's another thing? So he's 18, but what would be, if we didn't know, where
But
could we
to
look in
HIPAA,
the patient's?
but due to HIPAA regulations, we're not allowed to disclose
There
information.
you go. That's right. If their information is not under his HIPAA, we can't say anything to him. That's right. Okay, so that's good. So what would you do? So what are some other things that we could do for these parents?
Just advise them to talk to her son because I can't do anything about it.
Yeah, that's right. All right, well, good. So this one was a pretty good one. Okay, so now let's flip it around. What would we not want to do?
Not share any information.
That's right. That's right. Very good. Okay, good. All right, so now we're down to chief complaint. So let's see here. Jasmine R., if you'll read chief complaint for me.
The chief complaint identifies the patient's reason for seeking care. That is, the symptom that is causing the patient the most trouble. The CC is used as a foundation for the more detailed information obtained for the present illness and review of systems sections sections of the health history. A medical assistant is usually responsible for obtaining the CC from the patient and documenting it in the patient's medical record. This information may be documented on a pre-printed lined form or entered directly into an EMR. Certain guidelines must be followed in obtaining and documenting the CC as follows. An open-ended question should be used to elicit the CC from the patient. What seems to be the problem? How can we help you today? What can we do for you today? The CC should be limited to 1 or 2 symptoms and should refer to a specific rather than vague symptom. The CC should be documented concisely and briefly using the patient's own words as much as possible. The duration of the symptom should be included in the CC. The medical assistant should avoid using names of diseases or diagnostic terms to document the CC.
Awesome. So documenting chief complaints. Following are correct and incorrect examples for documenting chief complaints. The correct example, burning during urination that has lasted for 2 days. Pain in the shoulder that started 2 weeks ago. Shortness of breath for the past month. Incorrect examples. Has not felt well for the past 2 weeks. The statement refers to a vague rather than specific complaint. Ear pain and fever. The duration of the symptom is not listed. Pain upon urination indicative of a urinary tract infection. Names of diseases should not be document chief complaint. The duration of the symptom is not listed. Okay, so for chief complaint, I want you guys to highlight the very first sentence where it says the chief complaint CC identifies the patient's reason for seeking care, that is the symptom that is causing the patient the most trouble, and I want you to highlight each of those bullet points above documenting chief complaints. Okay, so present illness. Alicia, if you will go ahead and read present illness.
The present illness is expansion of the chief complaint and includes a full description of the patient's current illness from the time of its onset. The medical assistant is often responsible for completing this section of the health history, which is documented on the same form as the chief complaint. See figure 1.3. Okay, or enter directly into the EMR. To complete this section of the health history, the medical assistant asks the patient questions to obtain a detailed description of the symptom causing the greatest problem. Much skill and practice in asking the proper questions are required to elicit detailed information. A general guideline for obtaining further information on symptoms is presented in Procedure 1.1, and a more thorough study for analyzing the symptom is included in Chapter 1 of the study guide for students.
Awesome. All right, very good. So if you guys will just highlight that very first sentence under present illness. Okay, so I'm going to type something here, and I want you guys to tell me if this is correct. So what would this be listed under? So
The chief complaint.
That's right, chief complaint. Okay, so that's my chief complaint. So what would, as a medical assistant, what would you ask for you to get your PI, your present illness, based off of sore throat for 8 days? Any ideas?
What was the question?
So our sore throat times 8 days, that's our chief complaint. So what questions could we ask our patient to get our present illness, our PI, based off of that chief complaint?
Does it itch?
Hmm?
I mean,
That's right, yeah.
If they have any other symptoms?
a cough,
Yep.
anything.
That's right. So now you're thinking medical assistant. Okay, so we've asked our patient what the chief complaint is. What brings you in today? Well, I've had a sore throat for 8 days. Okay, well, tell me about the sore throat. Does it hurt more in the morning or at night or all day? Does your throat itch? Have you noticed a cough? And then you can ask this as detailed as you want. So you can go to, well, have you taken anything for it? Have you noticed anything that helps? Anything that makes it worse? Have you had a fever? So those are the questions that you have to kind of start getting in your mind now as a medical assistant on what to ask the patient, right? And then not only do you have to know what to ask, but you have to know where to document it. So, very good. Any questions on that? Okay. So now let's go on to past history. Ba-dum-bum-bum-bum. Natalie, will you please read past history?
The past medical history is a review of the patient's past medical status. See Figure 1.3b. Obtaining information on the past medical care assists the provider in providing optimal care for the current problem. Most medical offices ask the patient to complete this section of the health history through a checklist type of form. The medical assistant should assist the patient with this section as necessary by offering to answer any questions regarding the information required. The past history includes the following areas: major illness, childhood diseases, unusual infections, accidents and injuries, hospitalizations and operations, previous medical tests, immunizations, allergies, and current medications.
Awesome, thank you. Okay, so I want you guys to highlight where it says the past medical history is a review of the patient's past medical status, and you're going to highlight each of those bullet points on page 11. I'm going to give y'all a moment to do that, and then we're going to go to page 8, and we're going to look at figure 1.3. All right, so now on page 8. Okay, so this is a health history form, okay? So we have our A, the identification data. So that's where we get the patient's name, their address, telephone number, today's date, male, female, married, separated, divorced, widowed, single, and the date of birth. And then we ask them their past history, hospitalizations, tests and immunizations, current medications, allergies, any accident or injuries, family history, social history, and then on page 10, the review of symptoms, and then progress notes. Okay, so this is a basic health history form. Whether the patient fills this out on paper, or you're asking the patient and putting this into the system. This is the information that we have to have on every patient. A lot of times, if they're a new patient, they're going to fill this form out, and then the next time they come in, you're going to ask them what brings them in. You're going to confirm their allergies, their medications, and you may ask them, has there been any change to your history since the last time you were seen? Review of systems, however, on page 10, that may be something that you're going to ask them probably periodically, okay? And I'm going to tell you an example of why we're going to ask this. So in dermatology, and I may have already mentioned this before, but in dermatology, we would have patients that would come in with a complete full body rash, or they have got these thick plaques on their elbows and in their groin area and on their knees. We would ask review of systems every single time they would come in. Okay, so let's look at the review of systems. So now I'm in dermatology, and I'm going to be focusing what part on the review of systems do you think I'm going to want to document? Yes, skin. Okay, so but we've also noticed that it's not just skin on this form. So even in dermatology, My review of systems that I would have to ask a patient, it includes all of these. It's not just skin, which we would think would be the only thing that we're concerned about. So let's say that the patient with just these really thick plaques comes in and they've had this ongoing for 6 months. Okay, but when the patient filled out the review of systems, or I would ask them, have you had any taste changes, any sore throat, fevers, headaches, things like that? And let's say that they said yes. Okay. Well, this is what's important to the doctor. So when the doctor reviews the review of systems and they see, okay, well, they're coming in because of some skin problems. But I see here that they've had a fever in the past, a sore throat, and a cough, let's say. Okay, well, the patient is showing symptoms of psoriasis. But did you know that untreated strep can cause psoriasis? So that's where review system kind of also helps the provider in diagnosing, because some diagnosis, some symptoms can mimic other things. So even though the patient's coming in for skin, but we see that they have had other symptoms, well, other symptoms can cause what they're having now. So the doctor may go and order a strep test, probably through the blood work if it's a dermatologist, and it comes back positive. Well, a lot of times if it was positive, if we treat that, what do we think is going to happen for the patient? More likely the psoriasis is going to disappear, and that has happened. So this is why every aspect of a patient's chart as a medical assistant, it's important that you ask all the questions, even if the patient is bothered by them. Everything we ask and everything that the patient says, it is a valuable piece of information that the provider needs to diagnose and treat their patient. Okay? All right, very good. So let's go on over to page 11. And now we're going to break the chart of the health history down even further. So we have family history. The family history is a review of the health status of the patient's blood relatives. This section of the health history focuses on diseases that tend to be familial. A familial disease is a condition that occurs in or affects blood relatives more frequently than would be expected by chance. Examples of familial disease include hypertension, heart disease, allergies, and diabetes mellitus. The patient usually completes this section of the health history and is asked to provide the following information about each blood relative: state of health, presence of any significant disease, and if deceased, the cause of death. So I want you guys to highlight the very first sentence, and where it says the examples of familial diseases include hypertension, heart disease, allergies, and diabetes mellitus.
So even if this family member was deceased already, they would still ask for the health.
Yes.
Oh, okay.
Yeah, and a lot of times that's going to come into effect if let's say my mother died of heart disease. Well, it's important, even if my mother was deceased, it's important that we know, because that could have been a genetic problem. So that's the reason why we ask. So even, yeah, unfortunately, even if our family members are deceased, it is important to know why, the reason of their death. Because some things can be genetic and could be preventable on my end if my doctor's able to catch it early, right? We know what to look for if, in that case, that was to happen. So yeah, we would.
I have a question.
Yes.
So what if they're like adopted, like they don't know who their parents are or something?
So that is a
Something like that.
great question. Yes. And even on health history forms now, that question is an option. It will ask you if you're adopted. And that's just something we will document. Patient is adopted, we are unknown for health history. And at that point, our doctor may order maybe just even a routine blood, a full, complete type blood work, just to make sure that there's nothing showing up. But that's a great question, and that is something that we need to ask and document if our patient says that they were adopted.
Okay, thank you.
Welcome. All right, so now let's go on to social history. This is always fun. So the social history section of the health history includes information on the patient's lifestyle, such as health habits and living environment. The social history is important because the patient's lifestyle may have an impact on his or her condition and may influence the course of treatment chosen by the provider. The social history also provides the provider with information regarding the effect that the illness may have on the patient's daily living pattern. If it is necessary for the individual to make a major lifestyle adjustment, for example, stop smoking, reduce working hours, the provider may recommend support. Okay, Jasmine, that'll be fine. Recommend support services to assist in this transition. This section of the history is usually completed by the patient and includes the following areas: education, occupation past and present, living environment, diet, personal history, and exercise. So for this, I want you guys to highlight the very first sentence and each of those bullet points. So why would we think asking a patient's occupation would be important when it comes for the provider? What do we think some ideas could be?
To know what type of environment they're in
Yeah,
and what they do.
yeah. Where do we think that would play a part? What type of occupation do we think?
Maybe if they worked with certain type of chemicals or gases or something like that.
That's right. Very good. Yes. So that's why we ask these questions. Okay, good. So that would be occupation. Okay, now what about diet? What would be some examples on why the provider needs this information?
To make sure you're eating healthy.
Mm-hmm. Yeah.
Because you could have diabetes from that rather than from your family.
That's right. Exactly. If I'm eating 18 ding dongs a day and my blood sugar's 250, well, that could be why. Yes. So we probably could just make some diet changes. Very good. Okay. What about personal history? Any ideas for personal history?
What exactly would personal history be?
So personal history would be considered of, so you could do probably alcohol, drugs, smoking, and some
Maybe to
things.
know.
Go ahead.
Oh, sorry.
No, it's okay.
Maybe to know what they've been through, like emotionally in a way and mentally.
That's right. So that also goes into that as well. Some personal history may include your sexual partners. Okay. So good. So what about exercise? Why would our provider want to know about exercise?
To see how active we are.
Yeah. Okay, so let's say that our patient is a lifts weights. What are some ideas that a patient may come that we need to ask this question that lifting weights could be a problem for the patient?
And the question.
Can't that cause heart problems or straining their muscles?
Right. If the patient is considering if they're having symptoms of heart problems, lifting weights may not be a good exercise for them. So we may need to recommend something different. Very good. Good. So this is why every single thing that we ask a patient, it does matter. You know, we have to, as a medical assistant, you have to ask the patient these questions. And even though it may not make sense, but for the doctor, it might. Okay, very good. Any questions about that?
No.
All right, so now let's go on over to review of systems. The review of systems, ROS, is a systemic review of each body system to detect any symptoms that have not yet been revealed. The importance of the ROS is that it assists in identifying systems that might otherwise remain undetected. The provider usually completes the ROS by asking a series of detailed and direct questions related to each body system. The results of this section of the health history assist the provider in a preliminary assessment of the type and extent of the physical examination required. Figure 1.3e shows an examples of an ROS paper-based form. All right, which we've already gone over. Okay, so for the review of systems, you're going to want to highlight that very first sentence. You guys are doing great. We are almost done with our very first chapter. Okay, so documentation in the medical record. Alexis, will you please read the first paragraph?
Documenting is the process of recording information about a patient medical record and is performed by medical office personnel who are involved with the health care of the patient. Medical record is considered a legal document. The information must be documented as completely and accurately as possible. Developing a good documenting documenting skills requires a thorough acknowledgement of documentation guidelines combined with much practice. To provide guidance in attaining this important skill, general guidelines for documentation are presented in this section for both STAR and the EMR, followed by guidelines specific only for the EMR. The medical assistant enters information to a button, drop down minus text entry.
Very good. Thank you. Okay, so you guys are going to want to highlight that very first sentence. The medical assistant should always take the time to document properly in the patient's medical record. Good documentation helps coordinate efforts in the medical office and leads to high quality healthcare. All right, general guidelines for documentation. Nancy, will you please read number 1 for me?
To ensure accurate documentation, specific guidelines must be followed. These are listed and described as follows. Number 1, check the name of the patient record before making an entry to ensure you have the correct record. If the medical assistant documents it documents in the wrong patient's record by mistake, information such as procedure that was performed on a patient may be excluded from the correct patient's record. From a legal standpoint, a procedure not documented was not performed.
Very good. Okay, so you're going to want to highlight the very first sentence on number 1. Check the name on the patient record before making an entry to ensure you have the correct record. So again, it also kind of tells that if it wasn't documented, it wasn't
Performed.
It wasn't done. That's right. But then we want to make sure that when we are documenting, we're documenting on the right person. If it was a paper-based, the first thing that we need to be doing before we call our patient back, before we speak to our patient on the phone, before we even send prescriptions, is we always check to make sure we have the right patient, the right date of birth before we do anything. All right, so number 2. Talia, will you please read number 2 for me?
Number 2, the document informs accurately using clear and conscious phrases. The medical assistant should be brief but thorough and should avoid vagueness and duplicate of information. It is not necessary to include the patient's name in the entry because the entire medical record centers on one patient. It is assumed the information refers to that patient. Each phrase should begin with a capital letter and end with a period. Do you want to keep going?
Yeah, go ahead and just read that next bullet point on page 12 for me.
Okay. Standard abbreviations, medical terms, and symbols can be used to help save time and space. It is crucial that the medical assistant first check the office policy to determine the abbreviations, medical terms, and symbols that are commonly used in that office. Using commonly accepted terminology avoids confusion. Others who read the record, a list of abbreviations and symbols commonly used the medical office is presented in table 1.1.
Awesome. Thank you, thank you, thank you. Okay, so for number 2, you're going to want to highlight the third bullet point where it says each phrase should begin with a capital letter and end with a period. All right, for number 3, spell correctly. Correct spelling is essential for accuracy in documentation. If you are in doubt about the spelling of a word, consult a dictionary. Number 4, Jasmine, will you read number 4, please?
Document immediately after performing a procedure. When a procedure has been performed, it should be documented without delay. If a time lapse occurs between performing the procedure and documenting it, the medical assistant may not remember certain aspects of the procedure, such as the results of the treatment or the patient's reaction. It is important to note that procedures should never be documented in advance.
Awesome. Very good. Okay, so for number 4, you're going to want to document. Highlight from where it says document immediately after performing all the way down to certain aspects of the procedure. All that needs to be highlighted. Number 5, never document for someone else. The individual performing the procedure should be the one to document it. You're going to want to highlight that you never document for someone else. Okay, so let's review this really quick. So 1, 2, 3, 4, and 5. So what is this telling us?
Basically, the outline to document once we do procedures or with patients.
Yes. So if I am going to give my patient an injection, a vaccine, I'm going to want to document immediately after I do it. This way I can make sure that everything's fresh on my mind. If my fellow MA says, hey, Ms. Daniels, can you document patient in room 2? I did a strep test on them. Nope, I'm not. What would be a reason why you do not want to document for someone else?
Ability,
Yeah.
Because
if
you
they were
don't know
to make
what happened in the room.
Yeah, what happens if that fellow nurse, they said for me to document a strep test, but what happens if they didn't do the strep test? Who do you think they're going to come ask about that? Me or the
You,
other medical assistant?
the one who
you,
documented it.
That's right. So now my butt's on the line for a test that wasn't even performed, but they said it was and I documented. So I'm the one who's going to have that discussion. Very good. Okay, so standard abbreviation. So and you're gonna see that we're gonna cover some of that in this chapter, but you're gonna see it when you are studying your root and abbreviations. That you always need to ask your facility, what, what are the okay abbreviations to use? Because there are abbreviations that mean two different things for that one abbreviation, because it's, it could go either way depending on the reference that you're using that abbreviation for. And you'll be able to see it. So that's just why you have to make sure that, if you don't know it, look it up. If you're not sure, ask. If you did the procedure, you document and you do it immediately. All right, very good. Any questions on that? All right, so that was for an EMR. So now we're documenting in paper-based patient record. So additional guidelines for documenting in the PPR are listed and described as follows. Use black ink to make entries in the patient's record. Black ink must be used to provide a permanent record. In addition, entries made in black ink are easier to reproduce when a record must be duplicated for insurance company purposes and a patient referral. So for number 1, you're going to want to highlight where it says black ink must be used to provide a permanent record. Number 2, write in legible handwriting. For the medical record to be meaningful to others, the medical assistant must document information legibly. If the medical assistant's cursive script is not legible, the information should be printed. Number 3, begin each new entry on a separate line and do not leave blank space. Each new entry should begin on a separate line and be dated with the month, day, year, and time, either AM or PM or military time. If part of the line is not needed, draw a single line through unneeded space so that nothing can be added at a later date. Number 4, each entry should be signed by the person making it. The signature should include the medical assistant's first initial, full last name, and title. For example, D. Bennett, CMA or AAMA. The following title abbreviations are often used for medical assistants. We have the CMA, RMA, MA, and SMA. So number 4, you're going to want to highlight where it says the signature should include the medical assistant's first initial, last name, and title. So let me ask, why do we think that we have to only put our first initial and write our entire last name? Why not the other way around?
because there could be more than
That's right. That's right. You could be dealing with 2 Debbies and you don't know. So that's right. Very good. So for you guys, when you get onto your externship, and now actually as of today, you can start using the SMA for student medical assistant. Now, is there a difference between CMA and RMA? Does anybody know? I don't expect y'all to know.
I was just about to say that.
Yeah, there's actually not much difference between an RMA and a CMA. And in most
We will
cases,
be certified, right?
say that again.
We will be certified.
You will be certified, yes.
Okay.
What will y'all have to do to become certified?
I'll take a test, but
Yes, you will. And I'm
yeah.
so excited for y'all to take that test. But yes, so that's the difference between a medical assistant and a CMA. So we're done with the classroom, we're done with the clinical, you start externship, you are an SMA, you get hired on from your externship, so now you're an MA, and you'll be an MA until you take your certification exam, okay? Once you are in your externship or even during clinic, you can sign up to request the study guide for your certification exam. And I highly recommend that everybody do so. Okay. Now, you cannot take your certification until you're done with your externship. But once we start clinic, this would be something that you would want to go ahead and get your hands on, is going to be the study guide for your certification so you can study for that test. All right, very good. All right, so number 5, never erase or obliterate an entry. If a documenting error is made, the medical assistant must never erase or obliterate it. Should the provider or medical staff be involved in litigation, erased or obliterated entries tend to reduce credibility. If incorrect information is documented, the medical assistant should draw a single line through incorrect information, permitting it to remain legible. The word error is then written above the incorrect data, including the date and the medical assistant's first initial, last name, and credentials. Some medical office may request that the reason for the change also be documented. The correct information is then inserted next to the error. Okay, so then it says see figure 5 or 1.5. So let's quickly take a look at that. So we see the proper method for correcting an error in a patient's medical record. So we see one line through the 9, error, the month, date, and the year, the medical assistant's initials and credentials, and then underneath it we see the correct information, and then again the medical assistant's initials and credentials. So it's still legible, and this is very, very important when you are writing, but it's also very important when you're typing. If you're having to use, obviously you can use backspace, right, if you're typing. But if you don't notice your error, you need to make sure that it's known that an error was made, because every single thing at any point, any of documentation can have to go to a legal trial. So we want to make sure that we are doing the right thing. Okay, so for number 5, I just want you to highlight where it says that you're never going to erase or obliterate an entry, and that obliterated entries tend to reduce credibility. All right, any questions about anything so far? Nope. Okay. So now we are documenting progress notes. So who would like to read that first paragraph?
Maintain progress.
Yes.
After completion of the initial health history, a system is needed to update the medical record with new information each time the patient visits the medical office. Most offices use progress notes to fulfill this function. Progress notes document the patient's health status and the care and treatment being received by the patient in the chronological order. Progress notes provide effective communication among medical office personnel and serve as a legal document. The medical assistant is frequently responsible for documenting progress notes in the medical record. In the PPR, they are usually documented on special pre-printed line sheets known as progress note sheets. These sheets have a column for the date and the time and a column for the documenting information. In the EMR, progress notes are documented by the medical assistant on a progress notes template. Type of progress notes that are often documented by the medical assistant are presented next, along with an example of each.
Awesome. Yes, Jasmine, it will be on YouTube later this evening, and I will send out a message letting you guys know when it is. Awesome. Okay. So for documenting progress notes, you actually only need to highlight where it says to update the medical record with new information each time the patient visits the medical office. So if you guys look in your clinic folder, you will see an example of a progress note, and that's something that we actually will be using when we get into the clinic. So there's two different ones. There's going to be one that actually asks for your patient's date of birth, chief complaint, your vitals, and then there's another one that says progress note, and it's blank with a whole bunch of lines on it, right? So those are examples of when you would document, or different ways on documenting your progress notes. So that's just kind of something that you can look at as well. All right, any questions on that?
What'd you tell us to highlight?
For the documenting progress notes, you actually just need to highlight that very first sentence where it says to update the medical record with new information each time the patient visits the medical office. All right, so documenting patient symptoms. And we are actually almost done with this. Okay. The medical assistant takes patient symptoms during the office visits and telephone conversations. Information conveyed during a telephone conversation helps the medical assistant determine whether the patient needs to be seen and the immediacy of the situation. A symptom is any change in the body or its functioning that indicates the presence of disease. Symptoms that can be classified as subjective or objective. A subjective symptom is one that is felt by the patient and cannot be observed by another person. For example, pain, pruritus, vertigo, and nausea are examples of subjective symptoms. An objective symptom is one that can be observed by another person and by the patient. For example, rash, coughing, and cyanosis are objective symptoms. The medical assistant should have a thorough knowledge of common symptoms and should be able to recognize them. Table 1.2 lists and describes common symptoms. Okay. I want you guys to highlight the meaning of a symptom, the meaning of a subjective symptom and objective symptom. Taking patient symptoms during an office visit consists of the following: obtaining a chief complaint and obtaining additional information about the chief complaint. If the patient complains of pain in the abdomen that has lasted for 2 days, chief complaint, additional information is needed to describe the pain, including its type, specific location, onset, intensity, precipitating factors, and duration. The procedure for taking patient symptoms during an office visit is outlined in Procedure 1.1. Additional skills and practice on taking patient symptoms are included in Chapter 1 of the study guide. Other activities that need to be documented. Procedures. The medical assistant frequently documents procedures performed on the patient, including vital signs, weight and height, visual acuity, and ear irrigations. Procedures should be documented immediately after they are performed. From a legal standpoint, a procedure that is not documented was not performed. In general, the following information should be included: the date and time, the type of procedure, the outcome, and the patient's reaction. The specific information to be documented is included with each procedure presented in this textbook. Administrative of medication. Documenting medication and immunizations administered to the patient is an important responsibility in the medical office. The documentation should include the date and time, the name of the medication, the lot number, if required, the dosage given, the route of administration, the injection site used, and any significant observation or patient reactions. So I want you guys to highlight where it says the documentation should include the date and time all the way for patient reactions. All right, any questions about any of that so far?
You said how to under administration.
Yes, so under administrative of medication, you'll highlight where it says the documentation should include the date and time, the name of medication, the lot number, if required, the dosage given, the route of administration, the injection site used, and any significant observations or patient reactions. All right, specimen collection. Each time a specimen is collected from a patient, the medical assistant should document the date and time of the collection, the type of specimen, and the area of body from which the specimen was obtained. If the specimen is being sent to an outside laboratory for testing, this information also should be documented, including the test requested, the date the specimen was sent, and where it was sent. In this way, the provider would know what the specimen was collected and sent to the laboratory when test results are not back yet. All right, so now let's quickly take a look at that figure 1.7 on page 14. Proper method for documenting the administration of medication in a medical record. All right, so if it was a PPR, which means what, guys? Does anybody remember what PPR stands for?
The patient record?
Yes. Very good. Okay, so for a PPR, we've got the date, the time, what was done, how much of that medication we used, and a temperature. What was the results, and overall, who did it? So we have at 9:15 a.m. irrigated right ear with 200 milliliters of normal saline at 98.6 degrees Fahrenheit. Moderate amount of serum is returned solution. Patient states can hear better, and who did it? So if it was an EMR, this is how it would look. And then document. So here's an example of documenting the PPR and the EMR. So this date, 10:15 a.m. Bicillin, a lot number 900. Well, that's kind of confusing. Units, IM, left dorsogluteal, and who did it. Okay, so now we have when, what was given, identification marking on what was given, how much was given, where was it given at, and who did it. And then what it would look like if we were doing it for the EMR. Any questions on that? Okay, so diagnostic procedures and laboratory tests. Let's see. Alicia, will you please read diagnostic procedures and laboratory tests?
Diagnostic procedures and laboratory tests ordered for a patient should always be documented in the medical record. If the patient does not undergo the test, documented proof exists that the test was ordered. Documenting diagnostic procedures and laboratory tests ordered by the provider protects the provider legally and refreshes the provider's memory of the procedures and tests being run on the patient when the results are not back yet from the testing facility. Information to include in the entry consists of the date and time, the type of procedure or test ordered, the scheduling date, or where it is being performed.
Very good. Thank you. Okay, so I want you guys to highlight that very first sentence, please, for the diagnostic procedures and laboratory tests. And then if we look on page 15 on figure 1.9, we have the proper method for documenting diagnostic procedures in the medical records. So for a PPR, we have the date, the time, venous blood specimen collected from right arm, sent to Ross Lab for CBC and differential on such and such date, and who did the testing. And then there's also an example at same date, 2 p.m., throat specimen collected, sent to Ross Lab for a CNS on such and such date, and the initials of the MA. And then we have the EMR document. So if we ordered a patient, let's say, to go get a mammogram, and we've noticed we ordered the patient to go on a Monday, and by Friday we've not heard anything on those test results, and we call the patient to see if they had it done, and they said, oh, I completely forgot, I'm not going to do it. We have to document, one, that when it was ordered, and we also document that the patient declined getting the testing done. Now, if we documented that we ordered the patient to go get a mammogram done at Touchstone Imaging, and we call and Touchstone does not have any record of the patient, we call the patient and they say, oh, I didn't go to Touchstone, I went to somebody else. We also need to document that. Patient did not get imaging done at Touchstone, patient went at such and such on such and such date, and then we can call them to request for those results. Does anybody know why we would want to document that information?
To know where we're going to request medical records from.
Yes. So let me ask this. If we ordered a mammogram and the patient never went to get the mammogram done, they declined it, why would we want to document that? What would be some examples of why that would need to be documented? Does anybody know?
The question again?
If the doctor ordered a mammogram and then we tried calling to get those results and they said that the patient never showed up, we called the patient and they declined getting the test done, why would that information need to be documented?
So it wouldn't look like you didn't document it.
That's right. That's right. So let's say that unfortunate events that the patient ended up having breast cancer.
To protect yourself.
Exactly. That's right. So this is to legally protect our doctor. The doctor ordered the test. So we're documenting that the patient declined getting the testing done because this covers the provider. So the patient can never come back and try to take a lawsuit. Go ahead.
Thank you.
Yeah, so that way so it helps the doctor, so that's why every single thing needs to be documented, because if it wasn't documented, it was not done. Same thing if a patient declines the results or declines getting a test done. All right, very good. So on page 16, we've got results of laboratory test. Let's see. Danae, can you read the results of laboratory test, please? Danae, can you hear me?
I'm so sorry. What did you say?
That's okay. If you can read results of laboratory test on page 16.
Okay. It is usually unnecessary to document results from laboratory reports returned from outside laboratories because the report itself is filed in the patient's record. In case of a STAT request or critical findings, the test results may be telephoned to the medical office, requiring the medical assistant to document the results on a report form. Careful documentation is essential to avoid errors which could affect the patient's diagnosis. Results of laboratory tests performed by the medical assistant in the office should be documented in the medical record and must include the date and time, name of the test, and test results.
Awesome, very good. All right, patient instructions. Let's see. Nancy, will you read the first, just that first paragraph on patient instructions?
It often is necessary to rely instructions to patient regarding medical care. Wound care, cast care, care of sutures. The medical assistant should document this information, taking care to include the date, time, and the type of instructions relayed to the patient. Many medical offices have printed instruction sheets that are given to the patient. The patient is asked to sign a form, which is filed or scanned into the patient's record, indicating that he or she has read and understands the instructions. The form also should be signed by the medical assistant, who functions as a signature witness. This protects the provider legally in the event that the patient fails to follow instructions and cause further harm or damage to a body part.
Awesome, thank you. Okay, so I want you guys to highlight that very last sentence where it says this protects the provider legally in the event that the patient fails to follow the instructions and causes further harm or damage to the body part. Other areas that the medical assistant is responsible for documenting in the medical record include missed or canceled appointments, telephone calls from patients, medication refills, and changes in medication or dosage by the provider. Okay, so let's look at, so first on page 16, we have figure 1.10. And again, that's just documentation examples of how you would document tests. Okay, so for the PPR documentation example, we have the date, the time, and FBG. Well, I can tell you that FBG means fasting blood glucose. And then the very next one is the date and time for a quick view and mono testing negative. So that's going to be for a mono test. For the EMR, this is how you would document a urinalysis that you did. All right, on page 17, we have patient instructions for wound care. We have PPR documentation example. We have a date and time. Phoned office states swelling in the right ankle is almost gone. And then we have the date and time, missed appointment scheduled for such and such date at such and such time. So why would we want to document all of this? I mean, why would we want to document that we gave the patient instructions for wound care? Any ideas? So there's something that will happen so much to you when you are out in the field is you documented that you gave the patient wound care for taking stitches out. Okay? And I've
And
documented that I
never received it.
do what? Say that again, Nancy?
I said, and patients will claim that they never received it.
Yes, they call in and they say, well, my arm is itching and I don't know why. Okay, well, that's not a problem. Well, it's probably because such and such. Well, I wasn't told that. Oh, I'm so sorry. I showed that we gave you instructions on how to take care of it. That happens a lot. So that's just another example of why it is so important that we document everything. If we gave the patient instructions, we need to document that we did, and we need to go over those instructions with them. We need to make sure they understand it, because if we know they understand it, then those are, I mean, that may be another phone call that we don't have to get, because we made sure that the patient understood what we need them to do. All right, very good. All right, so now let's go on over to page 18, table 1.1. So we are not going to go over all these. I am going to ask that you read them and study them, but a lot of them are already going to be in your abbreviation and root words that I've already given you. But I do want you to highlight on page 21 on table 1.2 under common symptoms. You're going to highlight diaphoresis, both the symptom and the definition, flushing and jaundice, dehydration, and vertigo.
What was the last one?
Vertigo is the very last one that you need to highlight. So you're going to want to highlight diaphoresis, flushing, jaundice, dehydration, and vertigo. All right, so let's see here. So on the abbreviation symbols and commonly used in the medical office, can any of you find a meaning that means the same thing as the abbreviation?
UTI?
Okay. So what is the meaning of a UTI?
Urinary tract infection?
Okay. What about QNS and QS? So QNS is quality not sufficient, and QS is quality sufficient. So what would be some examples that we may want to document these abbreviations?
Good question.
What would be some examples of why or when we would be documenting QNS or QS? Does anything come to mind?
Maybe when you're quantity not sufficient, like in a urinary.
Yep, that's right. So that would become into effect if you are doing a venous blood draw, a urinalysis. So yes, so any type of testing where we may either not have received enough sample or we did. We need to document both. Very good. Okay, so Q234H, QID, and AC. So AC is before meals, Q234H is every 234 hours. QID is 4 times a day. So what are examples that we would be documenting these abbreviations?
Medicine?
Yes, that's right. So when it comes time to writing prescriptions, so as a medical assistant, you will be writing and sending medications, prescriptions out, whether it be electronically or actually having to fill out your prescription for your provider. Now, if it's on the paper, of course, your provider is going to have to sign, but providers actually may want you to fill out the information. So this is why it is super, super important that you guys study your root words and abbreviations, because you are going to need to know them. All right, so let's take a quick look at the abbreviations used to document body parts and locations. All right, so we got ABD for abdomen, EENT, eye, ear, nose, throat, eye, ear, nose, and throat, GI, gastrointestinal, GU, genitourinary, L with a circle around it, or LT for left. Then we've got a LA, LL, LLQ, LRQ, LUQ, RRT, so on and so forth. Okay, so in the very first part of your binder, you guys will notice some sheets that give you, let me see which one it is. Okay, so I think it's like your third or fourth sheet. There is a picture of the abdomen area, and it's got some dotted lines on it, right? So this is where the LLQ, LRQ, LUQ, RLQ, RUQ, that's where those things are going to be. That's the quadrant area, and we'll go over that further. But that's where you'll see those initials. All right, very good. Okay, so for page 21, the common symptoms, I've already provided you with some common diagnosis and symptoms. These are some more that you also need to become familiar with. All right, now I want you guys to turn to page 22. So now we have your first procedure 1.1, obtaining and documenting patient symptoms. Each chapter, you're going to see these procedures. Some chapters, I'm going to have you highlight parts of the procedure, but ultimately, I want you to study this. You need to read it over. If you need to take notes on it, you can. But it is important that you do study each procedure. That's what's inside every chapter. Okay, so make sure you guys read that. And then on page 24, now we have terminology review. So this is something else that you can use to take notes. And each chapter will also go over this. So it's a good way to make notes and make a little study guide, note cards, flashcards, anything like that to help you study. All right, so guys, that is chapter 1. We are done with our first chapter. All right, so can any of you, let's see, Anastasia, would you happenly please go to your Evolve calendar for today and tell me what you see? And everybody can go along with this as well. Anastasia, are you able to get it?
Yes, I'm logging in.
Okay.
And you said to go to the calendar, correct?
Yes, ma'am.
Okay, for today it says, oh, going away. Chapter 1 video evaluation quiz for Chapter 1 and apply your knowledge Chapter 1.
Okay. Very good. So for today, you guys are going to log in, and you have until midnight tonight. You'll log in, you'll do the video evaluation for Chapter 1, and you can also click on the little links that are on for today. That'll kind of give you a quick access. But I believe you are also going to want to do study guide questions for Chapter 1. Anastasia, can you tell me on Chapter 1 study guide the pages?
Mine doesn't show the pages.
Let's see, you may have to actually
It's 5 through 12 evens only.
Yes. Okay. So you're going to go to your other book. Remember the one where it says study guide on top of it. So you'll go to Chapter 1 and you're going to do those pages, and you only have to do the evens, right? For Chapter 1.
Yes.
Okay.
That's what it says.
Yeah.
Do the even pages,
Just do the even numbers.
even numbers.
So you'll do those pages, but you're only going to do 2, 4, 6, 8, 10, so on and so forth. Okay.
Got it.
But since it is 5 through 12, we still do 5, right?
Yes.
Okay, that's what I thought.
Well,
Okay.
yeah, so those are the pages, but you're only going to do the even number question on those pages. Does that make sense?
Yes, we're
Okay.
gonna do pages 5 through 12, but on those pages we're only doing even numbers.
That's right. That's right. Okay, good. Now, the YouTube links that are posted on the calendar, you don't have to go watch, because in the live lecture, we went through everything for Chapter 1 that I need you to highlight. Now, you can if you want to, but those videos only show you basically the stuff to highlight. So you do not need to do that. So you will need to make sure you do the video evaluation, the apply your knowledge, and the study guide questions. We'll grade the study guide questions tomorrow morning during live lecture. Okay.
Earlier I did my apply your knowledge, but whenever I tried to do the video evaluation, it doesn't let me. It says that it's like overdue or whatever. It doesn't let you access it.
Okay, hold on. I'm gonna go look at it right now. Give me a second.
Okay.
Is that where it says maximum number of attempts unlimited? That's what I'm getting.
You have to click the second link under it.
All right, so let me look here.
It says apply your knowledge.
Yeah, I opened the stuff for this week, but I may need to go back and change the date. So hold on, let me look.
Mine has said that too until I did. I clicked the link on the bottom and it said I can do it.
All right. And this is the video evaluation, right, guys? For chapter
Mm-hmm.
one? Okay, let me